Hi, I'm Laurie Hess. I'm a bird and exotic animal veterinarian and owner of the Veterinary Center for Birds and Exotics in New York. And today I wanted to talk to you a little bit about one of my favorite subjects, when you should bring one of your pets, in this case a rabbit, to the veterinarian. Unfortunately, a lot of people don't think about bringing their exotic pets in at all until they're really sick. We promote preventative medical care at my hospital, the Veterinary Center, but we really want to educate pet owners about what they should be looking for in their pets to know when it is time to call a vet. And bunnies are kind of funny. They're a prey species, so they're really good at hiding their signs of illness until they're really sick. And we don't want to wait until they're showing outward signs of illness to bring them into the hospital. So some of the things you might want to look for are obvious. Obviously, if your rabbit is very lethargic, not moving, is refusing to eat, or only eating certain foods, those are a good sign that something could be wrong and you should bring the rabbit to the vet, or certainly call your vet to discuss these problems. Other less obvious signs would include a head tilt, some abnormal neurologic behavior like sticking the leg out in a funny way, kind of just looking glassy-eyed or quiet. Certainly if you saw discharge from the nose or the eyes, or heard a lot of sneezing, or saw a lot of drooling, or obviously if you saw teeth growing in an abnormal way. Their teeth grow continuously, so they can get a lot of dental problems that can affect their ability to eat. These are all signs that you should bring your rabbit in. A lot of rabbits sit in the cage, so we may not notice that they're doing these abnormal things until we get them out and moving around. But obviously if a rabbit is lame, or holding up a leg, or seems to be licking a leg or a foot in a great number of times, that's a really important sign too, to be bringing your rabbit to the vet. Obviously they have a beautiful hair coat. If you see hair coming out, if you see a lot of scratching on the rabbit's part, or if you see scaly skin or scabs, that could be a sign of a skin problem. These are all signs, again, that something is going on with your rabbit. And you don't want to rush to the internet and look everything up and diagnose your pet that way. Certainly you can seek the advice of other people that own rabbits, breeders, good friends, but really if there's a serious problem going on, you should go to the veterinary hospital. And just remember, rabbits, again, can be very quiet. Sometimes they are not tremendously active, and until you get that rabbit out and moving, you may not notice that there's something going on. Regardless of why a rabbit may stop eating, because there are many problems that can lead to a rabbit stopping eating their normal food, rabbits are very prone to getting something called gastrointestinal stasis, which is a slowing down of the movement of food through their intestinal tract. They ferment food with the help of a normal, healthy population of bacteria that live in their gut. And if for some reason they stop eating, whether it's for any of the signs that I mentioned before, they can develop gastrointestinal stasis secondarily to whatever the primary problem is. And the problem is that the secondary gastrointestinal stasis can upset the normal bacteria that live in the gut, fermenting food, and can lead to the overgrowth of abnormal gas-producing bacteria that make them very uncomfortable. And for whatever reason, if they get gastrointestinal stasis, that can be a life-threatening problem. So you don't want to wait till the rabbit is showing those signs, not eating and not passing stool and feeling sick, because that can lead to a life-threatening situation. So again, if you have any questions or problems, you should seek out the advice of a veterinarian and keep all of these signs that I just mentioned in mind when you're questioning whether it's time to bring your pet to the vet.